My name is Pedro Braga, and I'm a third-year medical student at Oklahoma State University College of Osteopathic Medicine at the Cherokee Nation. The title of my presentation is Racial Disparities in Emergency Department Wait Times for Patients Presenting with Chest Pain and Shortness of Breath, an analysis of the National Hospital Ambulatory Medical Care Survey from 2019 to 2021. Extended emergency department wait times are associated with adverse health outcomes, including increased rates of insufficient treatments, admissions, and mortality. Chest pain and shortness of breath, or dyspnea, are common presenting symptoms of several life-threatening conditions, including acute MI, pulmonary embolism, aortic dissection, and tension pneumothorax. Given the potentially fatal outcomes associated with chest pain and dyspnea, a timely medical workup is essential to minimize morbidity and mortality. Given that people of racial and ethnic minority groups disproportionately experience health disparities, identifying some barriers to care in the ED may impact already vulnerable populations, thus improving ED wait times. My primary objective was to assess the differences in ED wait times by race for patients presenting with chest pain and dyspnea, using the National Hospital Ambulatory Medical Care Survey. Secondarily, we also looked at urbanicity, including metro and non-metro, in relation to ED wait times. Using survey weights provided by the NHA-MCS, we determined national estimates for ED wait times for 2019 to 2021 by ED triage level for patients presenting with chest pain and dyspnea. We constructed a linear regression to assess the difference in wait times by race ethnicity. We also applied bootstrapping to account for unbalanced samples between racial ethnic groupings. We also controlled for race, sex, age, triage level, and urbanicity. Our results in the sample, consisting of 3,900 people, representing 11,405,629 patients, the average wait times for emergent triage level scoring was 26.99. We found that all racial ethnic minority groups experienced longer wait times compared to white patients, except for the patients belonging to other multiracial. Black patients experienced the only statistically significant increase in wait times compared to white patients, according to our binary model. We also found that ED wait times in non-metropolitan areas displayed statistically significant decreased wait times compared to metropolitan areas. In conclusion, our study demonstrates that racial disparities in the ED persist, given the increased wait times for minority patients. Potential barriers include language barriers, systemic racism, lack of interpretation services, and inadequate health literacy. Racial disparities in the ED are complex and often multifactorial. Therefore, expanding research to identify strategies to further mitigate contributing factors are crucial to reaching health equity. Improving ED wait times for minority patients is crucial given that these patients historically experience a variety of other health disparities as well, which can further impact their condition. Thank you.